Well, thank you, Mr. Chair and Ranking Member Crapo, for having this hearing, and thank you, Mr. Secretary, for being here. I want to start with a discussion of state opioid response grants. I was really pleased that the department's proposed budget includes $2 billion for state opioid response grants. These grants, which I've worked since 2017 to secure and expand, have really helped my state significantly improve our response to the fentanyl crisis. Last year, you and I discussed this program's impact in New Hampshire. New Hampshire's been really hard hit by the fentanyl crisis in particular. We discussed the importance of continuity of funding because it helps states plan and avoid drastic cuts. And just before the hearing, we were talking about a program in Rochester, New Hampshire called Hope on Haven Hill, which focuses on treatment, recovery, and transition for pregnant moms and parenting moms who have substance use disorder. And the continuity of funding has been really critical for them to be able to develop that program and really help these women turn their lives around and get better. So in last December's appropriations bill, Congress acted on a bipartisan basis to require HHS to, and this is a quote, prevent unusually large funding changes from year to year in these grants. I know from our past conversations that you understand and share this really important goal. How does HHS plan to implement this statutory requirement to prevent year-to-year funding cliffs in state opioid response grants from states like New Hampshire?
Senator, first I have to say thank you because in many ways these are your babies. These SOAR grants, you championed them and you made it possible for us to actually get money into communities who need to deal with opioids, and you're saving lives, so thank you for that. The President has followed your lead. He's calling for some $2 billion in investment. That should help a lot of these agencies that are administering the funds to get services to folks who are trying to get off of opioids, a way to know that they're going to have a consistent and hopefully permanent stream of support, because the last thing you need is be there one day, but not the next. And the work that you all are doing is helping us not only make sure that we institutionalize these programs under the SOAR grant program, but that we also make sure that it stays consistent so that we don't have one day you have the resources to do it, and the next day you got to close down all these shops. Right. But we'll work with you on that.
Well, I appreciate that. I really just wanted to make sure that your staff and mine will continue to work on this. It's everything from certainty and predictability for patients, as well as being able to recruit people into the workforce to do this work, right? So I look forward to working with you and your staff on that.
Thank you.
Now I want to turn to discuss Title X family planning funding. I want to thank you for including robust funding for maternal and reproductive health in the department's budget, including doubling funding for Title X family planning to $512 million. Along with Senator Warren, I'm leading a letter to appropriators echoing that request. Title X is the only federal program dedicated to providing family planning, and it's historically been a program that's been underfunded. But we all know that in light of the Supreme Court's decision last year to restrict women's reproductive freedom, this is a program that's more essential than ever. So can you speak to the importance of Congress appropriating this essential Title X family planning funding? And then I want to ask you one more question, so if you can be a little bit brief.
Family planning hasn't received a boost in funding in 8 years.
Yeah.
It's time. We know how essential it is. It's not just funding for one type of care, it's funding for family planning services. Indispensable. The President's budget recognizes it. We look forward to working with you to get that across the finish line so we can actually expand services and get them to communities that absolutely need them.
Well, and it's absolutely essential to a woman's capacity for self-determination and dignity, so I appreciate it very, very much. I want to turn to one other issue, which is the MAT Act implementation. At the end of last year, the Mainstreaming Addiction Treatment Act, MAT, which I led with Senator Murkowski, was signed into law. This bill eliminates needless, outdated restrictions on healthcare providers that prevented them from prescribing buprenorphine, a critical treatment option for people struggling with fentanyl and other opioids. I know that you and the administration more broadly are strongly behind this new law, and I really want to thank you for you and your colleagues' work to support it. Can you please speak to the importance of these changes and what HHS is doing now in coordination with other agencies to expand access to buprenorphine by ensuring that healthcare providers know about these changes?
Senator, gosh, where do I start? Medication-assisted treatment is critical because it's one of the ways you save a life.
Yeah.
If you can get buprenorphine to an individual before they OD, you've just saved a life. If you can try to remove the barriers that kept a physician from participating in a program to be able to prescribe a life-saving drug, you've saved a life. And when we were able to really remove the X waiver cap, we were able to make it more likely that a physician would want to participate in this program and not find themselves subjected to law enforcement oversight as if they were encouraging drug use. What we did was we liberated the system to actually treat drug addiction and take away the stigma. So we look forward to working with you on that.
Well, I look forward to that too, and just, I'm over time, but one of the critical things here is going to be making sure that we work with law enforcement as well as healthcare providers to stock bupe in pharmacies and make sure that primary care physicians and other primary prescribers know that they can prescribe this life-saving medication. So thank you. I look forward to continuing to work with you.
Thank you.
And thank you for your work, Senator Hassan, especially on Title X, an enormously important program, and it hasn't come up yet today.